Hey, it's Luke, and in this video, we're going to talk about the benefits of testosterone replacement therapy. And if you want the science for the benefits, you can do some of the research on your own. In this video, we're going to talk about the subjective benefits, some of the things that I've experienced over about 4 years on testosterone replacement therapy myself. So let's dive in first onto the physical benefits of TRT, because I think that's what drives most men into seeking out testosterone replacement therapy. So first off, you're going to notice that you can gain a lot more muscle more easily on TRT. And I would say that muscle gains happen 20, maybe 30% quicker on TRT. Now, at the beginning of this video, I want to make it clear that we're discussing doing TRT through a doctor's prescription. We're not talking about taking your testosterone levels past the normal male levels, okay? So what TRT, if you're not familiar, what it does is it is injections that you get from the doctor of bioidentical testosterone, and it is used for men with low testosterone or men with average testosterone who want to take their testosterone levels to optimal levels and keep them there. Because the human body is subject to fluctuations in its testosterone levels. For example, men's testosterone is highest in the morning. It is low after you eat. It drops by about 20 or 30% if you have just 1 or 2 hours less than your average night of sleep. And in the evening, your testosterone is at its lowest point, which is not ideal for a lot of reasons. One, mainly because girls and their sex drive, it's higher in the evenings, and it's lower in the mornings. So men are always wanting to have sex when they first wake up, and women want it in the evenings. So let's continue on the physical, and we'll go straight into some of the sexual benefits, since that's where we led into right there. So harder erections. This is one of the things that you notice right out of the gate when you're on testosterone. It happens very quick. A lot of the testosterone replacement therapy benefits take 3, 4, 5 weeks to start taking effect. For example, your muscle gains and getting leaner. These things take quite a while to take effect. When they go into effect, you notice them. It's very significant. But one of the first things that you'll notice in the first week is harder erections and lasting longer in bed. So it takes longer for you to climax. So if you're the type of guy who has issues going too fast, that would definitely help out with that. And if you've had trouble keeping it up, once you start on TRT, that problem is over for the most part. You're still subject if you're training way too hard. Testosterone will not save a broken nervous system, but for the most part, you can keep it up under any circumstance. So that's one of the really cool things about testosterone. There's speculation. Some people say that it can give you a bigger penis, and I've confirmed that that's true. I've had both of my past girlfriends have told me that it's increased in size on a testosterone cycle. Okay. So I think testosterone does have an effect there, and it may just be that it increases the quality of your erection and makes it harder. So it seems bigger. But I think that I've noticed a permanent change after about 4 years. It's not a massive difference, but maybe a half of an inch that it actually adds on there. So one of the other things physically is it makes you stronger. And this goes hand in hand with more muscle. But even if you're not packing on a lot of weight in terms of muscle, it'll take the muscle that you already do have and it'll increase your strength of using that muscle. So it's kind of like the fighters or Bruce Lee, they would take ice baths, right? Fighters take ice baths so that they're basically putting on strength. They're gaining muscle strength, but the size of their muscle is not increasing. I noticed a bit of a similar effect on the TRT happening in that area. Now, in order to gain muscle, I want to say that you still have to consume lots of protein. You have to have adequate calories to gain your muscle. But some of the things that testosterone does is it gives you added protection against muscle loss. So for example, if you are traveling and you have a couple days where you're off your dieting game and you don't get enough protein, or say you're hiking and you're burning a ton of calories and you're not getting enough calories back in for quite a while, testosterone can save some of the muscle. So for example, if in that scenario you're hiking for a week or something, going backcountry hiking, and you would normally lose like 10 pounds of muscle in that week of just low calorie and working hard, well, you're probably only going to lose maybe 1, maybe 2 pounds of muscle. So that is a really cool benefit of TRT in the physical realm. Now, you're able to get away with more shitty food when you're on TRT as well without adding fat to your body. All right, now let's move on to the mental. So I had a huge increase in my ability to focus when I got onto TRT. It really allowed me to laser in on one thing at a time without skipping and jumping around from my phone to this other thing to watching TV or giving somebody email. And it allows you to basically harness your mind and stay focused on one thing. And part of the reason for that is it increases your mental endurance, or at least it does for me. I'm able to lock on and work on something. If previously my limit for sitting down at the computer was about 30 minutes, probably bumped me up to maybe 45. So probably a 20, maybe 30% increase in my ability to focus. And part of that is due to the emotional benefits that you get from TRT, which are more confidence, more motivation to work. You're inspired to get up and work on projects, conquer the world, feeling like the king of the hill, things like that. I feel more of a sense of purpose since I've been on TRT. I've got less depression, less second guessing yourself. So if you start to make a decision and move in a direction, there's less of going back and thinking, oh, did I make the right decision there? And of course, with all those benefits, you're better with girls. You're more confident, more relaxed in social situations. You're taking up more space. You are confident in who you are and your ability to communicate what's in your mind. You speak up more. You talk with a deeper voice. All these different things are going to come as a result of the hormonal changes that TRT provides. And one of the best things is it gives you lower tolerance for bullshit in relationships. You are better at setting boundaries. Now, this takes some personal work as well. It doesn't just happen like that. But the increase in aggression kind of leads to this lower tolerance attitude and helps you set clearer boundaries and take less abuse from people in your life. And all these things add up to give you a huge benefit and a massive life change just by simply doing TRT. Now, this video wouldn't be complete if I didn't talk about some of the downs of TRT. So let's just tap into that real quick. One of the downs of TRT is it decreases your chances of fertility. So fertility issues. And for this reason, when I first got on TRT, I went in and froze my sperm just in case I had issues with that in the future. But the science says the more years on TRT, the more effect it has on possibly giving you fertility issues. It doesn't happen with everyone. It's not 100% certain, but it's very likely. So for that reason, I froze my sperm just in case. One of the other downs is if you are prone to acne or balding, then it's going to speed up balding and acne. So one of the things that you can do to combat the acne is take an estrogen blocker, which if you go through a doctor, they are going to prescribe an estrogen blocker. And if you are on a adequate dose of estrogen blocker, it can help with the acne. Some people recommend experimenting without the estrogen blocker first, but you should really just go read the TRT Bible by Jay Campbell and couple reading that with your doctor's advice, and that should give you a good approach for the estrogen blocker, which helps you combat some of those downs. With the balding, if you are prone to male pattern baldness, you're kind of screwed. It's going to speed it up. So anytime you increase the androgens in your system, whether that's through testosterone or some other type of anabolic or androgen, you are going to increase your rate at which you bald. So if that's in your genetic line, you're going to speed it up. But if it's in your genetic line, then it's happening anyways. And for me personally, I obviously shaved the dome. The benefits were worth losing some hair for me. One of the other downs, which I actually consider an up, is your aggression goes up. Now, it's kind of like money in that it's going to amplify who you are. So if you have this increase of power, right, and you're a dick, well, you're going to be more of a dick, right? If you are short-tempered and aggressive in a bad way, like you treat people like shit in your life, well, you're probably going to do some more of that. If you are a kind person who is well-mannered and polite and relatively chill, then it's going to increase your assertiveness, your aggression, in that you might take less shit from other people. You might be quicker to stand up, quicker to introduce yourself to people. That's kind of an aggressive move, right? So it increases the aggression, but not in a negative way, right? Like you're not out there picking fights and trying to fight people when they're walking down the street, unless that's already in your psyche. And you already know. A good indicator of if the aggression is going to treat you bad is, how do you behave when you're drunk? Do people consider you a fun drunk? Are you the type of person who becomes the life of the party? Or when you're drunk, are you the one who's like angrily like trying to fuck with people and things like that? So if you're a kind person, you're probably not going to just flip a switch and all of a sudden become a dick because you have elevated testosterone. It just makes you more of who you are. And as far as the other downs, if you are very old or if prostate cancer runs in your family, and you already have elevated prostate enzymes, elevated BPH, then it's going to lead to that increasing most of the time and can lead to some complications, accelerate prostate cancer growth. Now, from my understanding, I don't want to dive too deep on this. I just wanted to mention it. But from my understanding, if you do not have elevated BPH, then you are fine. If you have those elevated prostate markers, then it's going to be a risk. But if you don't, then you should be fine. And that's what I weighed in here. In my case, I went and got the prostate exam before the TRT. I did not have the elevated markers, so I felt like it was a smooth move going forward. So those are about the only downs that I've heard of in TRT. And the other thing I guess I would say is that you have to prick yourself once or twice a week, depending on your doctor's protocols. And that can be annoying, but it's not the worst thing in the world. The benefits far outweigh getting over any needle fear or the inconvenience of pricking yourself. So that is the benefits and a little bit of the downs of TRT from my point of view. And if you have any questions, feel free to comment below and I'll respond as soon as I can. If you like this content, go ahead and like and subscribe, and I'll be putting out more. Thanks.